Hello, I'm Mohammed Alghoul. I'm a plastic surgeon and I practice in Chicago, Illinois. I'm extremely honored and thrilled that our article, Retaining Ligament of the Face, Review of Anatomy and Clinical Application, was among the top 10 articles downloaded from the Aesthetic Surgery Journal. This is an article that I wrote with Dr. Mark Codner while I was doing my fellowship with him in Atlanta a few years ago. The retaining ligament is a very important topic, and I realized the importance obviously when I was in residency. I went to the cadaver lab under the direction of Dr. James Zins, and the project at the time was really to study the relationship of the zygomatic facial nerve to the retaining ligament of the face. I actually love facial anatomy, and I realized the importance of the retaining ligaments, and I went back and I obviously read previous work done by other pioneers in the field like Dr. Stuzen and Dr. Mendelsohn, and I basically realized that there was a lot published about this topic, and there was different terminology, different descriptions. There wasn't a single article that really put it all together, so that's how we came up with the idea of writing the article. So if you look here in the first illustration we really wanted to show the relationship of the ligament to the different grooves that and wrinkles that appear on the face, especially with aging. So this picture is showing basically two hemifaces with a youthful hemiface compared to the aging hemiface, and just illustrating the different grooves that appear on the face and how do they relate internally to the retaining ligaments of the face. And as an example, we all know the tear trough deformity and how it correlates with the orbicularis retaining ligament, the mid-face groove correlating with the zygomatic cutaneous ligament, and so on and so forth. Another thing that we wanted also to demonstrate is the relationship of these ligaments to the muscles of facial expression and the muscles of mastication. As you can see here in this illustration, not only that it shows all the retaining ligaments combined, it also shows the relationship of each one of them to the corresponding muscle. For example, we have the superior and inferior temporal septum and their relationship with the temporalis muscle, the orbicularis retaining ligament and its relationship to the orbicularis muscle, the zygomatic retaining ligament and their relationship to both the zygomatic arch, zygomaticus major and minor, and then the masseteric retaining ligaments and their relationship to the masseter muscle, and the mandibular cutaneous ligament and their relationship to the depressor anguli oris muscle. One other thing that actually is fascinating about the anatomy of the ligaments is as they continue into the subcutaneous plane, they branch into very tiny branches. Basically, it's a fascial network called the retinacular cutis. And it is believed that the continuation of the ligaments into the subcutaneous fat divides the subcutaneous plane into the superficial fat compartments that were described by Roerich and Pessa. These slides really show the clinical application of the retaining ligaments and how do they apply to facelift surgery. For example, we just wanted to illustrate where do you need to divide the ligament, which plane do you need to divide the ligaments in different types of facelift surgery. For example, if you're doing a subcutaneous facelift, you really need to divide the retaining ligaments in the subcutaneous plane. While if you're doing a dual plane or subcutaneous subsmas facelift, you will have to divide the ligament both in a subcutaneous plane and a deep smas or the subsmas plane. So for example, if you want to effect any change in this area and you're starting your dissection in this area where it's marked A, you're going to really have to divide the ligament in between. We also wanted to demonstrate how does that also apply to plication in facelift as well. This is a very important slide. The temporal anatomy is very complex, and the retaining ligaments in that area were thoroughly described by both Dr. Nyes and Dr. Mendelsohn. Interestingly, they both described exactly the same ligaments, but they gave them different names. So in this illustration, we wanted really basically to superimpose both the ligaments described by Nyes and the ones described by Mendelsohn, and basically show the different names to basically show that these are exactly the same ligaments, but they really just had different names. And finally, I feel is the most important illustration of this article. It highlights the importance of the retaining ligaments as landmarks to find the branches of the facial nerve. It's actually very interesting that each one of these retaining ligaments have a very intimate relationship with one of the facial nerve branches. For example, the temporal branch of the facial nerve runs very closely just inferior to the inferior temporal septum, while the zygomatic branches of the facial nerve, they have a very intimate relationship with the main zygomatic retaining ligament and the upper mesenteric retaining ligament. The buccal branches, on the other hand, they have a very close relationship with the mesenteric retaining ligaments. And the mesenteric retaining ligaments actually basically, they are located at the transition point where the nerve pierces the parotid mesenteric fascia and become more superficial, more prone to injury. Finally, the marginal mandibular nerve has a very close relationship with the mandibular retaining ligament. Again, thank you for the honor of making this article one of the top 10 articles downloaded from the Aesthetic Surgery Journal. And if you haven't read it yet, I hope that you download it from the Aesthetic Surgery Journal, and I hope that you find it useful. Thank you.